Uh, your stomach pain could be cancer. Here is how to know. You have been having this stomach pain, which has been persistent, and you could be just thinking it is gas. You have been persistently ignoring it. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. In this video, we are going to look at stomach pain and some of the warning signs when it is not just stomach pain and it could be cancer. So how do you distinguish just normal bloating and life-threatening symptoms? You have been ignoring that stomach pain. Could it be early cancer, or are you just suffering from gas issues? So these are some of the things that why this topic matters. Over 1 million people are diagnosed with stomach cancer each year. Most think that it is indigestion and they miss it out. And then it could be ulcers or reflux, and you just oversimplify it. By the time it is diagnosed, it is already too late. Cancer whispers, it does not scream. So you have this 47-year-old man who has been having persistent bloating. He has been having progressive weight loss. And by the time he was diagnosed, it was stage 3 stomach cancer. He had ignored the early signs. He felt he was healthy initially, and he did not think he had the risk. So his final word was, if only I had checked sooner. So what are some of the warning signs that you should not ignore, especially when you have persistent abdominal discomfort? If you have a burning stomach pain that does not go away, so despite taking antacid, the pain is persistently there, it is not changing, and you are feeling bloated. Feeling full too quickly when eating. And this is not just a one-time thing, it is persistently there. Then you have unexplained weight loss. If you have blood or darkening of your stool, then that could be a red flag. You have persistent nausea or loss of appetite. If you have persistence of these symptoms for more than 2 weeks, then this is not just the normal gas. It could be a serious problem. So who is at risk of getting stomach cancer? Adults who are older than 48 years, those with the chronic ulcers and gastritis. If you have been persistently been treated for ulcers, then and you are above 40 years, you may need to think of doing an endoscopy. If there is any family history of cancer of the gastrointestinal symptoms, if you have a poor diet, you have been a smoker, eating salted food, or you are using alcohol, or you have persistent infection with H. pylori. H. pylori is one of the risk factors for stomach cancer. And many people do not take it seriously. They just get treated, but they don't bother to recheck whether the H. pylori has cleared. One of the biggest risks of H. pylori, apart from causing gastric ulcer, it is associated with stomach cancer. So if you have been diagnosed with a H. pylori, it is good after the treatment to recheck again, especially after 6 weeks, so that you are very sure that the H. pylori has been cleared, so that it does not cause you serious problems later. Then common misdiagnosis that can mislead diagnosis of stomach cancer. You think it's just stress. It seems like just persistent acid reflux. And sometimes you just keep trying antacids. Remember sometimes that stomach cancer can mimic harmless problem at first. But if they persist, then you need serious investigations. So what are some of the investigations that can change your life? One, having an endoscopy. This is a camera that is put into your mouth, goes down your esophagus to your stomach, and looks through your stomach. And if they diagnose any ulcer, they take a biopsy and it is checked in the laboratory. It will confirm whether it's just an ulcer or there is any signs of cancer. Doing a H. pylori test, it detects H. pylori, and if it is positive, it is treated, and this reduces your risk of getting stomach cancer. If you do a stool test for blood, that will help you to know whether you are passing blood in your stool. Then an ultrasound or a CT scan. This will diagnose hidden masses and will also help you know whether you have any other complications like stones in your gallbladder. So do not fear the test, but fear the delay. So what can you do today to prevent from getting stomach cancer? Eat fresh foods, cut down and not smoked or salted meat. Eat more grains, garlic, and even ginger. Avoid non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and in one of my previous videos, I've looked at some of the dangers of overusing non-steroidal anti-inflammatory drugs. Avoid them when necessary. Test and treat for H. pylori to prevent chronic inflammation of the stomach. Consider early screening if you feel at risk. So, what do you need to tell your doctor? If you have had this symptom persistently, then you need to let your doctor know. If you feel that you could be at risk of something serious, discuss this with your doctor. Take a symptoms checklist and see what are your risks. Be firm, your life depends on you and you know yourself, and talk to your doctor. So if you feel that you could be having some of these persistent abdominal discomfort, which you cannot really tell what it is, it would be good to do an endoscopy so that you are sure that you are not carrying a silent killer in you. Share this and remember to subscribe to the Overall Health YouTube channel for more tips on keeping healthy. Thank you for watching.